Okay, let's talk about ATI, or ATI policy. Um, right here, I copied this out of your syllabus, so you will have access to all of these ATI instructions and policy here. Now, if we come up here to the top, let's see, the instructions. Practice assessments are taken outside of class time, online at students' convenience. Students have up to 500 minutes to complete the practice assessment. Um, Now, it's done at your convenience, but you need to have it done by the due date, of course. Students should use time wisely and not rush through the assessment to reduce the required amount of remediation. In other words, if you take your time when you're doing the test, you won't have to do so much remediation to get the points. All remediation is required and due within 1 week. Now, I'm not going to hold you to that this time. This is 2021. Fall semester, so can't hold you to that this time. This is the first time we've used ATI, and I wasn't able really to help you through it. I've had to study up on it this weekend. It's pretty simple, but I just hadn't had time to get to it up until now. Let's see. But normally, and if you're not in the fall semester of 2021, it will be your remediation will be required to be done within 1 week. Students will not get additional points if remediation is not completed within that 1 week, and it will be counted as one of your late missing assignments. So you only get 2 of those in a semester, so you need to get this done. But like I said, I really cut you some slack this semester. To be successful in this course, students must complete all required remediation. In other words, even if you say, oh, it isn't worth all that work just to get the points, in order to pass the course, you have to go through this remediation. So now, if we look at the bottom half of this little chart here, it shows how many points you can get. You can get 50 points, right? Let's see what you got to do to get 50 points. Well, you can get 100% on your practice assessment, and then you get the whole 50 points. If you get 99 down to 93, you'll get 45 points. If you get 92 down to 85, you get 40 points. 84 down to 77, you get 35 points. 76% or below, you get 30 points. Another thing that I need to mention is that your ATI points will all total up in an ATI category, and they will count for 10% of your total grade. Well, it will probably be pretty hard to get 100% on the test. I don't know. I mean, if you take your time, you might. And in order to get your 50 points, you don't have to do any remediation if you got 100%. However, if you were in this A category here of 93 to 99%, you don't have to do much remediation. Complete all focused review modules for a minimum of 1 hour. Take post-study test if it's available. It probably won't be if you scored that high. Then you need to submit 3 active learning templates or 3 critical topics to review, and handwritten and scanned in. So I'll show you how to go about doing that here in just a minute or two. But the thing to notice is that you can get all 50 points even if you scored badly in your first attempt to take the practice assessment. If you scored really good, that 99 to 93 I just showed you, I mean, you've got 1 hour where you do the remediation and you do these active templates, or you do the 3 critical points, which I'll show you, which is maybe more helpful than the templates. For me, I think it would be, but it just depends on how you think and what you think will help you the best to learn this, so that if you have to take the post-test, that you'll be able to do better on it than you did the first time on your first test. Now, down here it shows all of those, and I don't think we have to go through each one individually, but you can look, and if you got a score down here, or if you got let's say way down here you got a 72, you're going to see that you're getting 30 points. Well, you want these 20 points, right? You want to try to get those back. So you have to complete all the focused review modules for a minimum of 4 hours. So you're going to spend 4 hours looking at that stuff to get your points back. And I will show you how to do this. But you can see here that you will be submitting 10 of these templates or 10 of these 3 critical point topics to review. And I'll show you what that is. It sounds worse than it is, but it probably, if you scored real low, it will take, you the 4 hours to do that. And even if it doesn't, you're going to have to make sure that you use 4 hours in there remediating. And hopefully that'll go pretty quick, because there will be a lot to look at if you scored that low. And if you scored way up here in the 100%, you don't have to do anything. And the 99 down here, you're only going to spend 1 hour, and really you'll be done with those critical points pretty quick, or the templates, whichever you choose to do. So now we're going to take a look here at your ATI. I'll grab this and kind of pull it out of the way. Now I've just gotten onto the student view, so hopefully this is the way you see things too. This is the home page. Up here at the top, see where they got the 4 tabs: home, my ATI, my results, and help. Go to my ATI. My ATI tab takes you here, and these tabs down here, it defaults to learn. And just you can take a look at some of these things. This isn't what we're talking about right now, but there's some nice stuff here that you can probably use. But I know that you're pretty darn busy right now, but just remember it's there, and try to use whatever you can off of ATI. I mean, you're paying for it, and it is well worth what you pay if you use it. In fact, look at the tutorial there for ATI Ts. Now, you've already taken the Ts, but maybe you know somebody who could use that. It might come in handy for them. Now, let's get back to what we need to talk about here. You go to your Improve tab, right? So we're in our home, we hit my ATI, we got here. Now we're going to this Improve tab right here. And that takes you here. Now, yeah, so right down here, I took this test. I got 47.8% on it. And you can see here, I can get my results. I can study materials, which is where we're going to go. And when you're done with this, you can take that quiz. Right, and some of you, I think I told that we were going to be doing it in class. Well, we don't. I didn't realize how they had this set up. I thought it was more like HESI. But so anyway, let's go ahead here and hit this study materials. Okay, and that actually did change the page here. It's just you got to scroll down to see what it added here. Hitting that study materials brought these study materials right below where we were working. So now it's right here is all of the concepts to the questions that you missed. So it narrows it down to the study materials that you will need as an individual. So let's take a look here at one of them. We could just start. Oh, and another thing is, look here, like this one here, basic care and comfort. There were 8 things on that test, and I got 1 out of the 8 correct. Over here, 4 out of the 6 correct. These are all things that I missed, and so you can see how bad you were. Basic care and comfort, I wasn't too bad. So maybe I'll open up something that I was worse at. It doesn't really matter. I've got a certain amount of templates. With a 47%, I would have to do 10 of them, right? Which of course I'm not going to do, but I'll show you how to do one. So it doesn't matter. We could open any one of these. Missed 1 out of 3 there, 7 out of 16 here, 15 out of 26 there. Well, let's open this one here up. Physiological adaptation. So I'll begin this. And that's just showing you what some of the different icons mean. So this brings us into the ATI test book. And then all of those, these are the concepts, right? It said you missed so many concepts out of that on that card that we looked at before, and here they are, right? And then it shows you the active template. I think there's 7 of them in total. Sounds right to me. And so anyway, this is the one that the active template that you would use for this particular thing here is this system learning. And if you go down, or it's system disorder, I'm sorry. If you come down here, now if you wanted to do this here, the active learning templates for the arthroplasty post-operative care are therapeutic procedures active templates. So see, depending on which one of these you decide that you're going to do a template on, it will bring up a different template for that particular one. It'll be one of those 7, right? Seizures and epilepsy intervention. So we must have missed something on there. So I could click on that, and then, by the way, these are critical points there, but we'll talk about them later. So I'm going to go ahead. The active template, learning template, is this system disorder. I'll click on that. And then when you get these here, what you have to do is you put your name in here, and they kind of limit as to how many. Like, see, 15 characters is all I can put in there. And then concept, I want to put the concept there. 15 characters left. So you're limited as to what you can put on this. So a good way, if you don't want to do that, the way to do it really is just to download this thing. And you hit that download up here, see? You can just download this thing and then print it off. Handwrite your information in there. And if we scroll down, you'll see what kind of page you're going to get. You're going to have all this stuff up here at the top that we saw. Alterations in health diagnosis. So right here is actually where you'll put seizures. Pathophysiology related to the client's problem. So you got to write all this stuff in. What kind of problems that would go along with health promotion and disease prevention. Let's see, risk factors, laboratory tests, right? Significant laboratory tests. Expected findings, right? So you just have to fill this whole thing out is what it is. Let's go look at one of the other ones too, so you can see how they're not all the same. System disorder. Let's see, for the infections of the renal and urinary preventing system, preventing urinary infections, something that must have missed something on, so you can look at the template there, and you'll fill it out, and it's a little bit different. Alterations, health diagnosis, risk factors, laboratory test, diagnostic procedures, expected findings, right? Safety considerations. So you would download that and then fill it out, and then you will scan it in and hand it into Canvas. Okay, so now I will get out of here. Oh, by the way, too, if you're wondering how much time you've spent, because we have a limited amount of time, up in the corner here, you've got that. Now, see, I've been in here almost 2 hours, hour and 57 seconds. Of course, you haven't been watching me that long, but I've been in here trying to figure everything out so that I could show you on this video. So I've been in here 2 hours. That's pretty fast 2 hours, too, I must say. I'm going to go ahead and cancel this out. So that brings us right back here to where it shows us all of the things that we've missed and all of the different templates that we could bring up. Okay, so I'm going to go ahead and back out of this. I'm just going to close this out. I'm going to show you something. Okay, so I'm just going to show you what here is in results. Got this page here, and if you download the report, it'll show this, right? And this here, what's kind of nice about this, I guess, is that from your assessment, your practice assessment, it has everything that you missed, and it has a topic here for you to review, which has to do with questions that you missed. So anything you miss has a review topic here, and it shows that. Now that's the same thing that we have in another form that is actually more usable. I just wanted you to be able to see this report. I'll close out on that. And we'll bring our study materials back up. So you might be thinking, where am I going to get the information to fill in on the templates. Well, you get those right here in your reading, right? So you can just go right here and click on the one, right, and it brings up one. So it's right here. And this is information on a question that was missed on the test. So, and it is information that will help you understand why you missed that. And there are, and so you can go there. Now that one, there's just one, but you come down here, there's a couple places. 2 and 3 have to do with the arthroplasty post-operative care, and so you can click on 2, and that will bring this up, and there's 2, and then so you just go on down the line, and you should be able to find all the information that you need to fill in those templates. And now, while we're talking about these critical points, I want to go ahead and bring something else up, and that is that you don't even have to do these active templates. If you look back here at our policy again, right, it says on here that you can do, like let's say we are in this one here, you can submit 5 active learning templates or 5 3 critical point topics to review. Right, so we'd have that that choice, and let me explain that choice to you. Like I was showing you, right here is the information for your templates. You don't have to put it in template form. And it might be easier for you. If you think like me, it probably will be easier for you to just go to your point and say, okay, pantoprazole, esomeprazole, right, all these PPIs up here that they're listing. And then nursing actions, right? So let's see. They suppress gastric acid secretion by irreversibly inhibiting the enzyme that produces gastric acid. So it might be a critical point would be on a piece of paper, you write this down, right? And then you could write down some of these nursing actions, things that you want to do. Things like don't crush the meds, whatever it is that you don't know, but make sure, try to write down the thing that's highlighted in yellow, because that's a point, right? That's one of the points that you actually missed. I'll hit this focus review and go back here. And then you know, actually we were way down there at the bottom, but you probably would start at 1, would probably be easier. And you don't have to do them all. You have to do 3, counts as 1 3 critical point, right? And that's kind of confusing. But see, if that's what it says here, right? You do, we were looking at this one, I believe, 5 active learning templates or 5 3 critical point topics to review, right? So you take 3 of these critical points, right? So that would be 1, and then you go back here, and you could come down and you could go to 2 and see what's the deal on this one here. Bring that back over. Monitor blood pressure, heart rate, and respiratory rate when given intravenously. Let's see what we're talking about here. Nursing administration, so nursing care. Magnesium sulfate. Okay, makes sense. And the thing about a magnesium sulfate, you missed a question that said that you probably didn't realize that you need to monitor the blood pressure, heart rate, and respiratory rate when given intravenously. There's a critical point, right? So we just went through 2 of them. You write those down on a piece of paper, any piece of paper that you want. Let's go back here, and we will come on down here. Hypertension, recognizing adverse effects. Let's bring that, open that up. Propranolol with the beta blocker, right? Happens to be a non-selective beta blocker. And so here's something, it's telling you what it's for. Hypotension, or what it can cause actually. Sinus arrest, fatigue, bronchospasm in patients who have asthma. And that's because it's non-selective. Non-selective beta blocker, and you can anything here that you didn't know, you know, like that you don't give in somebody with asthma. Monitor for chest pain, dyspnea, apical pulse, right? And you just write down that critical point. It doesn't have to be long. It just has to be something that you didn't know, and now you just learned it here. And if you look at that and say, well, I don't know why I missed that question because I knew all this, then that's not a critical point for you. So let's go back now, right? And well, anyway, you do that 3 times, and that counts as 3 critical point. And then you have to do, in that particular one that we were looking at, right, you have to do 3 critical points. So you have to do 3 of those 5 times, right? So you're going to do, so then you would have that one there completely, and then you could go back, close out of this, right? We've just done 3 of them, let's say, and you could actually do 2 of your 3 critical points, right, which would be 6 critical points. I mean, 2 of your 3 critical points on that one topic if you think that you need that, if that's what you think will help you the most. So I think we just did that one. So let's say that we are on this one, right? So you're going to go click on this one, and you'll do the same thing, right? And you'll get 1 or 2 3 critical point groups out of this, maybe. Let's see here. You got 1, 2, 3 right there. So you can click on that one, and that one. Get the information, write it down on your piece of paper, and there's 1 critical point. And that looks like that's probably about, well, it says there's 5 here. Oh, right down here. And here you got 2 more. So you could actually get 1 critical, and then you could get these 2. And then you can just, it doesn't have to be one of these. All of these little yellow highlights with the numbers, those are directly related to something you missed. Now that doesn't mean that there's not something else in that chapter when you're reading through this that right here's your critical point thing. But you might come down here and you'll see something else. And even though it wasn't one of your yellow highlighted things, it's something that you think you need to know to raise your score on the test. When you retake the test, you'll say, oh, I'm going to write that down, right? So then you get another critical point, or you can create another critical point. So you would possibly have these 1, 2, and then one other one that you just found in there. And then up here we already had 3 on there. So yeah, you can do that. And then you can also, then you've got to kind of go back to, and you pick another topic, and that's your critical points. Now, I want to bring up just one other thing here that I can think of. There's probably a lot of things to bring up, but I'm thinking of this one. When you get up here at these high scores, like 93 to 99, you might not even have enough of those critical points showing up to do the 3 critical points. So, but you can look in your reading, right? You can still look in your reading and find 3 critical points, I'm sure, right? Well, actually, it would be 9. 3 sets of 3 critical point topics to review. 3 things that right? So that'd be 9 different things that you didn't know. So you still will be able to pick up your 5 points, right? So if you do these reviews the way that you're supposed to, by the time that they are due, you will pick these points up. So you can still end up with the 50 points, right? You might be down here, way down in the 30, because you got a 72, which wouldn't be unusual at all. But you do all of these here, and then you will pick up that 20, and you have to do them anyway, right? But if you do them on time, you'll get the 20 points, and then you have 50. Then you have your 50 points. Now, the person up here, the smarty pants that got a 50 or 100% right off the bat, they don't have to do remediation by getting the 50 points. But at least if you missed 1 or 2 or 10, you will be able to get that 50 points.